Thanks for listening to the Lunch and Learn with Dr. Barry, here to help educate, motivate, and put you on the right path to take control of your health through weekly discussions on topics in the medical field, public health arena, and in your community. And now your host, Dr. Barry.
And welcome to another episode of the Lunch and Learn with Dr. Barry. I'm your host, Dr. Barry Pierre, your favorite board-certified internist, founder of drbarrypierre.com, as well as the host of the number one podcast for patient advocacy, helping you empower yourself for better health. This week we have episode 98, where we are going to be talking about the rising drug costs here in America and how it affects you, the patient. And fortunately, I want to tell you, it does in a negative way. We're going to be talking about some of the most ridiculous drug price increases that have happened over the years. We're going to be talking about how it's affecting real life families as we speak and what Congress wants to do about it. So, like always, if you want show notes, head over to lunchlearnpod.com or whatever app you love listening to the podcast to. You should be able to check out the notes there. And don't forget, if you have not had a chance yet, please leave me a 5-star review on Apple Podcasts. Your reviews are much appreciated, and I would love to give you a shout out if you do so. So leave me a 5-star review. Send me a screenshot of you doing a 5-star review, and I'll make sure on the next episode we give you a shout out. So let's get ready for another amazing episode here with the Lunch and Learn and Dr. Barry. All right, guys, so this is definitely one of those times where I hate to be associated with the healthcare industry. Again, it doesn't happen very often, but once this topic comes to hand, fortunately, I'm on the side of wrong, right? So, obviously this podcast is all about the patients, all about empowering the patients and being an advocate for the patients. So I'd be remiss not to really talk about drug prices and the rise of drug prices over the years and how that's really negatively affected patient care. How has it negatively affected the doctor-patient relationship, and honestly how it's killed people, right? Like the rising cost of drugs here in America is an absolute reason why people are dying, right? People are having to make life and death choices every day when it comes to medicine, right? I understand. But we can't be forcing them to make these decisions based on the prices of drugs that we're essentially manufacturing, right? And we're going to talk today about a couple scenarios of prices that have risen out of nowhere, right? That have blindsided families, that have, left people in financial ruin. And what do we do from here, right? So I think, and at the end, that's where I want to end up, right? I want to be able to say, like, okay, this is what we got to deal with here in America. These are some of our options, right? And I think you need options. I'm always a fan of options. I think as the patient advocate, right, you need as much options as possible, right? Like again, I love myself, right? I think I'm the best physician, right? But you should have more options than a person like me when it comes to choosing your healthcare, right? And the same goes for our prescription drugs. We spend a lot of money. Again, we'll talk about that on the show. Spend a lot of money on these prescription drugs, and we're not getting the benefit that comes to it, right? So I want to bring you the first scenario, right? The first scenario is a family who is taking care of a young kid, right? Young kid who was this fit guy. He ran track in school, and all of a sudden he realized that he was getting more and more fatigue as he would run track, right? Now, of course, it's not like when I have to run on the treadmill and I get tired over time. No, this is a kid who is used to running on the track. He was a long distance runner, but he started noticing that the more he ran and the longer he ran, it became more and more difficult to do so. And unfortunately, he eventually had to stop running, right? He ran track for, as a sport, but he eventually had to stop doing it because he just could not physically get up and move anymore after running, let's say, a mile, right? And this is, again, he ran long distances, and all of a sudden he couldn't do it anymore. Lo and behold, after, fortunately going to see a doctor about all of these problems, he was diagnosed with this rare neuromuscular disorder, which is interesting because depending on when you're listening to this episode, this is actually a rare disease week, right? He was diagnosed with a disease called Lambert-Eaton myasthenic syndrome, right, or LEMS, right? If you Google it, it's LEMS. And what occurs is that it's a autoimmune disorder, right? And we've talked about it in the past. Autoimmune disorders are essentially the body attacking itself. Unfortunately, this specific disease makes your muscles very tired and decreases the strength in your muscles, and it actually works the harder you work them. So if you're a person who never works your muscles, right, and you don't have no problem, right? But if you're a runner and you're doing physical strenuous activity, and you used to be able to run 1 mile with no problem, all of a sudden you run a half mile and you're like deadbeat tired, right? So this was a disease that he was fortunately discovered to have, and it affects about 3,000 people here in the U.S. And up until a few years ago, the medication that he used to be able to use, right, because he's on medication now, he's better now, he's able to do his track and field, he's able to do his sports, but the medication he was able to use used to be free, right? And so I wanted us to kind of get that mental picture, right? A family member of yours has this rare disease that only 3,000 people in the United States have, and fortunately they're able to get that medication for free, so their life is able to change, they're able to do what they do and kind of live out a normal life as a kid. All of a sudden, right, and this is what's concerning more than anything else, all of a sudden, you have a drug company who owns the drug that used to be free, and they say, you know what? Let me buy that off you, right? So a business opportunity comes about where another drug company buys that drug from a different one, adds a little preservative, right, which doesn't add any effect to the drug. All it does, it makes it last a little bit longer. And now all of a sudden, they're charging $375,000 for the same drug you used to get for free, right? So let's ponder that for a second, right? A drug I used to be able to get for free through government programming, right? It's now $375,000 a year. Guys, I want you to kind of sit back for a second, right? And how many people who are listening to this show right now have an extra $375,000 just lying around to take a medication that's going to be able to greatly affect their life, right? Exactly. Not many people, right? But here this drug company, right? And I even hate to call it a drug company because all they're clearly the selfish greed has overtaken them. But here this drug company comes in, adds a little preservative that adds nothing to the medication, and all of a sudden medication's free goes to $375,000. And this is an unfortunate situation, right? To the point where congressmen had to get in, like the hearing had to occur, because again, this is like, what are you doing, right? We're like, what are you doing? If you are for the patient, if you are for patient care, how can you justify adding that price tag? And what a theme you'll hear throughout the show is the most common retort that you get from these drug companies is, the cost of marketing, the cost of, just preservatives and everything else and competition, all of these things that they will essentially kind of make up and say, no, this is why we have to justify the cost. Oh, and by the way, there are government programs out there and the quote unquote newer government programs out there that can, help absorb some of this cost. And I say absorb because a lot of times it's not the patient who has to directly pay this money. What tends to happen when you have these drug programs, that those are usually tax funded. So now people who are paying taxes are now paying more taxes to a fund to take care of this drug company's $375,000 bill. Right. So that's the first one, right? And that's enraging to me. I couldn't imagine being that patient's doctor and having to explain to them like, hey, yes, I know this medication you used to take that was for free last week is going to cost you a pretty penny, right? Because again, you don't go from $375,000 to free again, right? Like they are going to have to spend some money. And if this is a family who is tight on the budget, Like maybe they can't afford to spend that money, right? Maybe they can't afford the extra 500. I'll just give a scenario: $500, $1,000 every month, right? Again, this is monthly, right? They may not be able to afford that on a month to month basis, and now they have to pick and choose. Like, do I take this medication? Do I eat? Do I take this medication? Do I put gas in my car? Right? Like, these are the real life decisions that patients are having to make today because of some of these unscrupulous acts by these drug companies. Next, I want to talk about COPD and asthma, right? This is a very common disorder. It's actually the third leading cause of death here in the United States. And as a primary care physician and now an internist in a hospital, I can tell you I take care of a lot of patients who deal with COPD and asthma and all of the effects from it. And if you know any patient, if you know any family member, friend, if you especially are listening to this show, you know that the lifeblood of your medications usually come in the form of an inhaler. Like that's usually if you have COPD, if you have lung issues, the medication usually treated is usually some type of inhalation type medication. But what's been happening, unfortunately, right? And again, this scenario happened a few years ago, where you have, and they I think this is published on NPR. What I'll do, I'll put a link to the show notes to the story, where you have this 67-year-old female who takes these inhalers, right? And they're 67-year-old, they're retired, they're on Medicare, so they have pretty fixed costs, right? They can't really deal with the rising cost of price, just like a majority of people cannot deal with this rising cost. And all of a sudden, medications that they used to take, that they used to be able to get, are now $200, $300, $400 every single month, right? And they literally can't afford it, right? They literally can't afford to pay a mortgage, pay their card note, pay the premium that it may need to get Medicare or whatever the health insurance is, and then have to spend an extra $400 on just one medication that they have to do every single day, right? So I can tell you what happens, and then I can tell you what tends to occur in the inpatient setting and the outpatient setting. So you have these patients who, again, are having to choose, like, hey, I need this medication, and maybe fortunately their doctor has some samples, right? Maybe fortunately their doctor may have a sample or two, and they give them that sample. But then they also give them a prescription, and they go to pick up this prescription at a pharmacy, and the pharmacist is like, hey, this thing is going to cost you like $300. So you know what they do is a medication that they were supposed to take every single day, right? All of a sudden they don't take it every single day. All of a sudden the medication, because they need it to last, right? So all of a sudden they're taking it every other day, right? Because they know if it costs me $400, if I take it every other day, now it's going to last me 2 months instead of 1 month. So now you see what happens in the inpatient outpatient setting. So now you tend to have more of these patients who come in what we call an exacerbation, right? Which essentially means that it got to the point where their inhalers at home wasn't enough to help with their breathing. And a lot of times they require to be put in a hospital, because by that time they're short of breath, they can't breathe at all. So I got to give you IV steroids, I got to give you breathing treatments around the clock, I got to have respiratory therapy. See, I got to do all of these things here, which, what does that do? It dries up the cost of healthcare in general. But most importantly, it dries up your costs, right? Because now, instead of paying for a home medication, now you got a hospital bill that's coming your way, right? And that you weren't ready for. But the reason why you're there is because you could not afford the medications. And I tell my residents all the time, especially when we're dealing with patients who are asthmatic, patients who have COPD, remember, third leading cause of death in the United States. When they come into the hospital, I rarely say that it's strictly because they're non-compliant, because I've been on that side, right? Like, I've been on the outside as the outpatient doctor, and I've had patients call me and say, hey, do you have any more samples of blank medication? And the hurt that I would hear when I say, I'm sorry, I don't have any more, because I knew, one, that they weren't going to be able to pick it up in the pharmacy, which meant now I have to be on high alert that you're not taking your medications, you're not going to be treated adequately, and you're going to end up in my office more often than not. And what occurred, unfortunately, as a again, the same like scenario, not necessarily preservative, but what occurred many years ago is that the delivering device, right? Because a lot of these medications used to be very cheap, right? The delivering device that these medications were in, companies said, hey, you know what? If I upgrade, quote unquote, if I upgrade the machinery that delivers your medication from an inhalation standpoint, I can now charge this as a new medication. And we see that over the years, and I'm going to just give you some numbers. We see that over the years, drug prices for some very common COPD medications have risen, right? For Spiriva has jumped to about 30%, which now costs a patient roughly $360 every month. So since about 2006, right? This price of Spiriva has jumped $368 per month, which is about a 30% increase. The price of Brio, another inhalation medication, has risen about 20% since about 2013. Again, that makes that number about $320 per month. Again, I want to stop and pause for a second, because if you have an extra $368 or $328, raise your hand, right? Like, I want you to really think about it. How many of us have that kind of money just lying around to spend for some breathing medication that they need? Exactly, right? Not too many. And another scenario, and again, I wanted to start out with that rare disease, because I know some people are going to be like, oh, well, it is a rare disease. You got to be able to charge more for the rare disease. But COPD is the third leading cause of death here in the United States. And yet one of the most common disorders we face still has that same problem of drug price rising and, lack of compliance because of the drug price rising. Many patients across the United States are strictly reliant on their doctor giving them samples for these medications. Many. So if the majority, and I hate to say majority, right, but we'll just say a lot of people, right? Because if two people are reliant on your doctor giving them samples, that is too many. So we have a situation here in the United States where having the medication isn't a problem. It's getting the medication in your pocket because it costs so much, right? That's the problem, right? Like, we got them, right? You go to CVS, Walgreens, it's back there, right? But if you can't afford to, take it home, it doesn't matter that it's accessible, right? Like, again, and we tote that a lot here in the United States. They're like, oh, you can get whatever you need here. All your medications are here. Yeah, that's great that it's here. It's great that it's behind the counter. But it does nothing for my patient who can't afford it.
This episode is brought to you by the Lunch and Learn Community Store, where we are living out the motto, empower yourself for better health. In the Lunch and Learn Community Store, you can get your favorite t-shirts, ebooks, as well as other related products by Dr. Barry. Head over to shop.drpiersblog.com and get a chance to get 10% off your first purchase by using the coupon code EMPOWER10. Again, shop.drpiersblog.com. Live out the motto, empower yourself for better health.
It does nothing for my patient who's in the grocery store but has to buy groceries, so they can't pick up their Spiriva, they can't pick up their Brio this month because they have to buy groceries. They have to take care of their kids. So that is a scenario, again, that's two different extremes from a disease course, but as you can see, the same pattern where the drug companies add something different. Right, they add something different that doesn't add any additional benefit to the medication, but it allows them to say, hey, this is a new product. I need to be able to charge you more for it, right? Which is absolutely crazy. So the problem has gotten so bad, right? And it's been a problem. But unfortunately, like everything here in America, our politics are button, right? Like everything in America, they have great lobbyists, right? So they fight for laws that protect themselves. They fight for laws that ensure that they're able to charge these ridiculous prices for them. So Congress had very recently, Congress had some of the biggest drug company makers, CEOs, give testimonies here to kind of say like, hey, what are you guys doing? Like, what are you thinking about when you charge these prices? And that's where you tend to get that parrot information of, well, research, and we're trying to keep up with the demand of everyone who across the world, right? Like they say, well, we charge here in the United States more, which is a fact I'm going to talk about a little later. We charge more for the same drug here in the United States because it costs more, right? And I want to tell you the reason why it costs more is because here in the United States we have much stricter laws on what you can market. We have much stricter laws on what you can say your drug is for, right? So they don't have that worry, I should say, outside this country, right? So they can say like, all right, this is for this medication here, we're charging this much, and they don't have to go through the regulations associated with it. And very interesting, right? One of the congressmen, which is pretty funny, asked one of the CEOs who apparently made about $22 million, right? Made about $22 million the year prior, and he asked them, this medication that you have, this CEO is actually CEO of AbbVie, who has a drug called Humira, which is used for rheumatoid arthritis, along with other things. And the price of that drug is about $60,000 a year, right? So it's not as bad as that $375,000 price tag. But again, I implore you, if you have an extra $60,000 a year, one, donate some to my nonprofit organization, and two, you're very lucky, right? And the congressman asked like, hey, is that bonus that you get, right? Because I think I got like a $4 million bonus. Is the bonus you get associated with the fact that your drug price costs $60,000 a year? And of course, you're like, no. The bonuses are tied to a lot other different things, and the price of the drug doesn't really matter. So when the CEOs are presented with these scenarios, and they say, hey, yeah, we wanted to drop the drug prices down, but it's not only us, right? So they get the finger pointing, right? They say, well, it doesn't just have to do with us. It has to do with the taxpayers, it has to do with pharmacy managers, and all these different, and those are like the CVS, Walgreens of the world. It has to do with all of these different issues that if you take care of them, then we can decrease our price. But if you're not going to take care of them, there's nothing that we can do, right? And that's unfortunately the issue, right? That's the unfortunate problems here in the United States, especially when dealing with the drug pricing and healthcare in and of itself. Many of you are either taking medications or have family members who take medications which are very affordable, right? I tend to send a lot of my patients to like grocery stores at Publix, because Publix has a line of medication that are completely free. But imagine if one day, the drug company who makes it gets bought out, and someone comes behind them and says, oh, this drug that used to be free, I'm adding a preservative so it can last a little bit longer. Oh, and by the way, now it costs you $10,000 a year, right? Like this is the scenario. This is a real life scenario that tends to happen over and over and over again, right? So those scenarios right there, I want us to, really get in the mindset, right? We talked about the rare disease, right? Whose number jumped from free to 375,000, right? We talked about COPD, the third leading cause of death here in the United States, but still drug prices are rising, and they're outpacing how much, if you don't realize it, they're clearly outpacing how much people get paid, right? So we're not paying people more, we're just raising the cost of everything they require to live around it, right? So I want to kind of shoot some facts, right? Because I know here in the luxury community, we love facts, right? Because facts are great, facts are quick and easy to remember. Drug pricing here in the United States are way too high, right? It's unfortunately going to become unstable to the healthcare system in general, right? The total cost of what we spend on drugs alone are about 20% of the total healthcare costs here in this country, right? So 20% is strictly focused on how much we spend on drugs, right? And Americans here are spending an increase of about 15% since 2014. There's an unprecedented cost of specialty medications with about 30% rise in cost, and those are the Humiras, that medication for the limbs. So these specialty disorders, the costs for them are shooting through the roof again, almost 30-40%. We talked about some of the COPD medications kind of associated with it. Spending will cost government programs. Again, remember I talked about these government programs because that's what these drug companies always rely on. Say, oh no, but we have government programs that, yes, I have this price tag of 60,000, 100,000, 375,000, but the government programs will make it much more affordable. But remember, if it's a government program, somebody has to pay for it, and if somebody is likely me or you. Right, government programs are going to cost us about $50 billion over the next decade. Right, so we're going to spend about $50 billion on these government programs to subsidize these drug companies because they wanted to raise the price on medications that they added preservatives on. Right, so they're going to continue to win in that scenario. Right, which is absolutely terrible. Prices for, again, the more common drugs are rising as well. 4 of the top 10 prescriptions in the United States have risen by more than 100% since 2011. Again, I repeat, 4 of the top 10 prescription drugs here in the United States, that price has risen up almost 100% since 2011, right? So again, it's not just the rare diseases, right, or rare medications, right? Medications that you commonly use today are going up 100% since 2011, right? So, and that's a problem, right? That's the issue. That's kind of where we're at here in America, right? And so, of course, you ask, right? Because you have to ask, right? Well, Dr. Pierre, what do we do, right? Like, what am I supposed to do with you telling me how bad the pharmaceutical industry is, right? Let me tell you what I tell my patients. I am a fan of out-of-the-country medications, and I know a lot of people may be squeamish, right? They say, oh my God, you can't trust this. But can you really trust a company that has no problem taking your medication for free and then selling it for $375,000 here in the U.S., but doesn't charge that ridiculous price outside the country? No, right? So I am a big fan of out-of-the-country medications, in particular the Canadian pharmacies, but there's a lot of European pharmacies as well that are reputable. Right, and in the show notes, I'll put some links up to some reputable sites that you can get your medications on. And it's not, first of all, let me tell you, it's not like you can go, you the patient, right? My listener, right? It's not like you can just go and say, oh, I want this medication, click a button, and it gets sent to you. You still have to go through the process, right? Your doctor still has to fill out paperwork and write an actual prescription and say, yes, I want my patient to get this prescription here. So that alone would tell you if a website is serious about their business, right? Because if you have to do that, you already know that, oh, okay, I can't just kind of cheap out the system here, right? Because if I do, something may come to bite me, right? No, this is one where the drug company will actually directly fax the prescription to your doctor's office, or you can print out the order form from their website, bring it to your doctor's office, right? Because they're going to fact check, they're going to make sure this is an actual doctor signing it, and then you can get those medications from there. I can tell you, my COPD patients, my asthma patients, we primarily used a lot of the Canadian pharmacies because the price, again, I talked about Spiriva, I think it was like $368, but if I did it through the Canadian pharmacies, it may be like $50, $75, right? Which again is much more affordable in the long run, especially if you want to breathe, right? Like, I want y'all to think about this right now. How many of you like breathing? Right. So a lot of people like breathing. So if you like breathing, you're going to need these medications. If you're a COPD patient, an asthma patient, you need these medications to breathe. And if you can't breathe, there's a problem. If you can't breathe, you end up in a hospital or worse, right? We already know what the or worse is. So you have a lot of great out of the country resources that can get you some of these medications, actually a lot of these medications at a much deeper price cut than what you'll get here in the United States if you try to go to Walgreens or CVS. So I'm a big champion of getting out and saying, like, I need the Canadian pharmacy medication prescription. Don't give me that U.S. pharmacy prescription, because until they play ball with us, right? And I say us because as a physician, it hurts me when I know you can't take your medication because you literally can't afford it, right? So it hurts me. And if the pharmaceutical companies don't want to play ball with us, then we need to make sure that the advantage is in our end. And as your patient advocate, right, like, I'm going to give you all of those tools. Like I said, in the show notes, I'm going to have the links to some of the reputable pharmacies out there. I'm going to have your back when it comes to this problem, right? Because this is a problem that's not the cause of you, right? So when we talk about non-compliance in the medical industry, especially as a resident, right? As a program director, my residents are constantly writing non-compliant, and I'm like, are they really non-compliant, or can they just not afford this medication, right? Because the likely scenario is that I think they like to be able to breathe, they just can't afford breathing right now, so they come to the hospital. So again, another great episode. Like I said, that's my time. It's about 30 minutes. Please, if you have friends, family members, please send this episode to them. Tell them to take a listen, and then send them to the website so they can get the show notes. And try to see if that medication that they're taking that may be costing them $100 this month, right? $100 a month, they could possibly get for 10 or 20 a month elsewhere, right? So I think if anything, if you don't get nothing from this show today, is that we need to be paying much cheaper prices for the medications out there, because we are paying the U.S. tax that other countries don't have to pay. So you guys have a great and blessed day, and I'm going to see you guys next week.
Thank you for getting to the end of the show. I am your host, Dr. Barry Pierre, host of the Lunch Learn with Dr. Barry, and this is another amazing episode that we like to bring to you week after week on betterment of empowering yourself for better health today. If you have not had a chance, please go ahead and subscribe to the show if this is your first time listening. If you already listen and you've already subscribed, make sure to leave me a 5-star review, because your support is absolutely important in keeping the show moving as it is. And if you have not had a chance and you want to check out today's show notes, always head over to lunchlearnpod.com. That is lunchlearnpod, all in one word, .com, and you can get the access to my show notes for every single episode, but especially the one you just listened to. And I'm going to see you guys next week. You guys be blessed. Bye.